Hello, my name is DeWitt Wilkerson. As we've had an opportunity to work in clinical practice under the concepts of complete dentistry for almost 30 years now, as well as working with thousands of dentists in hands-on settings, there are some great clinical tips that can be of so much help to us as we seek to help our patients. And so I'd like to share some of those tips with you to help you in your practice. We've discussed how using an anterior deprogrammer can be helpful for releasing the lateral pterygoid muscles and allowing the joints to seat fully to centric relation as we clear the dance floor of all occlusal influences. We've also discussed the fact that we can then take compound and place it on the occlusal surface of the deprogrammer, and with bimanual manipulation seat the joints and close into the softened compound on the occlusal surface and create what we call a CR index. Now the patient is able to hinge and close in centric relation all by themselves without us having to use our hands in order to verify centric relation again. Next, we want to go ahead and record this centric relation with the index using Delar wax. What we're going to have to do in this case is we're going to have to cut a little window out. So I'm going to heat up the central portion that is where the index is. We'll take a Bard Parker knife and heat that, and I'm going to cut a window just like so out where the index is over the teeth in the patient's mouth. Now we'll go ahead and heat the wax carefully down the sideline on the right and the left, making it warm enough that it looks wet but quickly looks glossed over. It doesn't drip, it isn't sparking or running. We're going to do that on the top and bottom, left and right. And we're going to do that several times to slowly get the heat to penetrate into the wax as it absorbs the heat and softens up so that we have a good working time. And we'll do that one more time. So left and right, top and bottom. Now we'll go to the mouth, and we're able to place this between the posterior teeth. And now the patient can simply close right into the CR index. Okay, as long as they're closing right into that index, we're right on target. We'll go ahead and remove the wax, trim it as we learn right through the buccal cusp tips. On the top here I'm using a Bard Parker. Some of our colleagues prefer scissors. Trimming right through the buccal cusp tips of the top. We'll trim through the OL groove of the last molar on the top. We'll then diagonally trim right through the buccal cusp tips below without disturbing what we just did on the top and establishing the buccal cusp tips exposures. Just like that. Go back to the mouth, place it precisely where it was before, close, and then we'll adapt any places there may be any separation between the edge of the tooth and the wax so that we establish a tooth wax tooth. Sometimes I'll pinch it in with my fingernail interproximally. Tooth wax tooth, between the upper and lower teeth, the wax perfectly positioned. Now we'll place that wax in chilled water for 30 seconds and then go back to the mouth and verify that we have no rocking left or right, front to back, that we're right in the CR index fully seated, and that we have tooth wax tooth, no soft tissue contact anywhere, tooth wax tooth. We can go ahead and re-verify with bimanual manipulation of seating like this and seat firmly and make sure there's no slide, but there shouldn't be because of the CR index. This is a wonderful way of taking a centric relation bite record in a very predictable manner, particularly as you're learning this technique. I think you'll find extremely helpful. I hope that you'll try this.